This is a great day for South Carolina, and my sincere welcome and greetings to all our friends and colleagues, including the board and the chairman of the board, Neil Williams from the Duke Endowment, Minor Shaw, K.D. Weeks, the staff, Mary Piepenbring, the team of Heath Sciences South Carolina. Everything that Chairman Williams mentioned could not have happened without the team. And we really appreciate that the board is represented here by Chuck Beeman, and our staff is around the room. And we're very pleased to have the Honorable Representative David Triple and his wife, and the Honorable Representative Carl Anderson. We thank you, and we thank Secretary Bobby Hitt for being here. As was stated, this is a very unique institution. Heath Sciences South Carolina, as was mentioned, was established more than 7 years ago as a result of the state's initiation of the innovative Smart Start program and through the vision of our hospital, our university, and our community leaders. Its mission is to improve and safeguard the health of South Carolinians by harnessing the power of biomedical research. The fruits of biomedical research and improved scientific literacy have for the past century proven to be among our nation's and among our state's greatest achievements. We've been able to eradicate certain diseases, save countless lives, and impact profoundly on the human condition. Heath Sciences South Carolina, with this opportunity offered by the generosity, and an important word here, and the partnership of the Duke Endowment, is now meeting a new international challenge: to translate the plethora of new fundamental research discoveries that take place in the laboratories around the world and translate that into improved delivery and care models and healthier lifestyles that will benefit not only South Carolinians and North Carolinians, but in fact all of humanity. The Duke Endowment past and present investments totaling, if you calculated what Chairman Williams said, over $32 million to Heath Sciences South Carolina and to its academic institutions and teaching hospitals, have created an innovative environment, one that's structured both on intellectual property, the whole concept of intellectual property, but more importantly, on intellectual generosity. That promotes collaboration, that promotes communication, and that promotes creativity. So we're very proud that the Duke Endowment has allowed us to have this coordination and collaboration opportunity for our state. This alignment of individual institutional missions has allowed us to capitalize on that initial grant, and we have brought in over $40 million additional dollars of external funding to South Carolina. And in addition, we've attracted other statewide organizations to form long-standing committed partnerships with HSSC. I'm just going to give you a couple of those partners. Most notable are the South Carolina Hospital Association, represented by Rick Foster here, Dr. Foster. The South Carolina Office of Rural Health, represented by Graham Adams here. The South Carolina Primary Healthcare Association. The South Carolina Departments of Health and Human Services and Health and Environmental Control. The South Carolina Clinical and Translational Research Institute that has its home base at the Medical University of South Carolina. Blue Cross and Blue Shield of South Carolina, and Premier Health of North Carolina. These aligned institutions, along with over 1,000 primary care providers serving our rural and underserved part of this state as part of our regional extension service, form a foundation of an alliance that is enriching the quality of South Carolina's growing and strongly growing patient-centered medical enterprise. HSSC today is embarking on a new strategic direction, one that balances the process of fundamental discovery with the validation and implementation of new delivery and care models. This new direction will help us engage additional stakeholders and encourage the creation and the development of new products, new jobs, and new industries. Our next 3 years that we're able to continue because of this great announcement today we will undertake completing the original HSSC vision, which was, quote, to transform positively the state's health status and economic well-being, unquote. And we will accomplish this by building on the information technology infrastructure that has been developed over the past 3 years by Dr. Ian Sanderson and his team at MUSC, at USC, and at Clemson. Our team of IT people go across the entire state, and we have members of that team in each of our hospital systems. By adding 3 new clinical cores to that information technology, we will be able to, 1, develop a methodological and statistical support unit. What is that? That will give us the ability to analyze the complex data, clinical data, that we are presently collecting in a statewide clinical data warehouse. This will support quality improvement research, clinical and comparative effectiveness studies, and patient safety programs. 2, a clinical research and evidence-based medicine infrastructure staffed by clinician providers, most of who will be affiliated with our supporting organizations. This includes physicians, nurses, pharmacists, social workers, and a small central professional staff who will develop new clinical trials, who will bring more business and more immediate healthcare support to the people of South Carolina. This will be population as well as individually focused. And 3, an implementation sciences program that will further and facilitate the dissemination and adoption of evidence-based practices by all providers and population groups. Thus, the next phase will be one of using research to improve patient care, population health in all settings, from hospitals to physician offices to home care situations. We are confident that as a consequence of our emphasis on the clinical population-based studies made possible by this Duke Endowment investment, HSSC's health-oriented discoveries and their applications will have a positive impact on one of South Carolina's and America's most intractable social and economic problems, and that is containing and reducing healthcare costs. In conclusion, we look forward to the addition of this most generous award, $11.25 million from the Duke Endowment, to our funding base. And with it, we look forward to the enhancement and establishment of a self-sufficient Heath Sciences South Carolina collaborative that is not equaled by any other state in this nation. We are grateful for the trust provided by our partners, and especially in the board and staff of the Duke Endowment. And third, we look forward to continuing our pursuit of new knowledge and the validation and dissemination of that knowledge with vigor, dedication, and integrity, with an end result of being a major contributor to improving South Carolina's healthcare and population health. I thank you very much.